Back pain, or is it menstrual-related lumbar weakness? Today's video is inspired by April Wang, one of the leading practitioners in Ottawa. She works with us at Lotus Care Acupuncture and Traditional Chinese Medicine Clinic. This month, her article focuses on this menstrual-related lumbar weakness, one of those cases that reminds us that pain is a symptom of something deeper, especially when women are reaching the years of experiencing perimenopause, a time when hormonal changes can sort of blur the line between mechanical and internal causes. Let's look into what April observed in her patient. April describes a female patient who came in with acute low back pain, mostly on the left side after a long flight and some heavy lifting. The pattern looked classic, aggravated by cold, tension in the lumbar muscles, tenderness around lumbar 2 to lumbar 3, and it improved quickly with acupuncture, about 80% better after the first few sessions. But by the fourth visit, something shifted. The patient no longer complained of pain. Instead, she said, "My lower back just feels weak, like it has no strength." And 2 days later, her menstruation resumed, even though she had been post-menopause for over a year. That unexpected return pointed to something deeper than just mechanical strain. So this is April's perspective from the angle of traditional Chinese medicine. The low back is the house of the kidneys. So when a woman in the age of reaching menopause or experiencing perimenopause, if there is lumbar weakness described, not sharp pain, but more of a dull aching, heaviness or dragging sensation, we often look at the kidney, so not just focusing on muscles. April noted that at first this case was presenting with cold, damp obstruction and qi stagnation, meaning the pain was external at the time, triggered by cold and movement. But later, once the acute phase passed and the external pathogen was expelled, this excess being gone now revealed an underlying weakness in the lumbar, meaning the underlying root cause of this, for this patient in particular, was kidney, qi, and blood deficiency, being linked to hormonal fluctuations and this reactivation of the reproductive cycle. April then realized the treatment focus must shift from simply relieving pain, this sort of branch symptom, to then focusing on this root, supporting kidney qi and regulating the Chong and Ren vessels, which govern the uterus and hormonal flow. So what is the relevance of this clinically speaking? April's reflections highlight a critical point. For women around menopause or perimenopause, low back pain is not always musculoskeletal. Hormonal transitions can cause sensations of heaviness and dragging in the lumbar, weakness, or even soreness, which tends to mimic chronic pain. April is really letting us know that if we only try to treat from the angle of muscles and joints and only treat it as a back injury, then we are missing something very vital. The body is trying to communicate something. In some cases, the reinitiation of a reproductive cycle can be a sign along the way, could be temporary, or it could be that this weakness is now being nourished enough to the point where reproductive activity can return. April then reminds us in her article that this is a signal not only to the patient, but also the practitioner to just listen to the body and know that the body has its own intelligence that we're working with in tandem, in collaboration. The body's story is always evolving. Reevaluating these chronic symptoms is really key when it comes to traditional Chinese medicine. In this way, we can completely change the outcome. April's takeaway is such a good one. Always look beyond the surface. Continue to read what is going on with the patient, not just tongue and pulse, but all the symptoms collectively, all the things that this patient is witnessing and reporting back to us. If this patient didn't feel comfortable enough to mention, "I feel this weakness, this almost emptiness in my lumbar," then many practitioners might just say, "Okay, your pain is gone. I did my job. You can leave and I won't see you again." But in this case, and in many cases, things shift and evolve and require us to reassess many of the time. Clear something that's in excess, like dampness or cold, obstruction, we can then start to work on an underlying deficiency, working to nourish our organs and our base substances such as yin, yang, qi, blood, jing. So April reminds us that we can't always assume that if a patient reports, "Oh, my back feels weak, my back feels tired," we can't always assume it's from overuse. there could be something underlying that we have to assess.